Hi, my name is Bianca. I'm an RN and certified pediatric emergency nurse in New Orleans, Louisiana, and I'm here to talk about union busting. So let's recap what a union is. Remember, a union is an organized group of employers at a workplace who collectively bargain for better. So in this case specifically, we're talking about the staff nurses of a hospital who get together, organize, and collectively bargain for better pay, better benefits, safe staffing ratio, better working conditions, things like float pool, storm activation, mandatory on call. All these things can be discussed and negotiated and bargained with your employer through a union. Okay. Unions advocate for safer and fairer working conditions, improve safe staffing ratios, reduce workloads to address issues like workplace harassment and discrimination. It is a protected federal right. The National Labor Relations Act protects the rights of employees to organize and to engage in union activity. So, what is union busting? Union busting are tactics that employers use to discourage and prevent their employees from unionizing. The goal is to prevent a union from forming and prevent discussions about a union in an attempt to weaken the union's influence and to prevent collective bargaining from occurring, right? They don't want you to collectively bargain for better. Union busting literally violates your federal rights. It undermines your rights as an employee to collectively organize, and it makes it harder for workers to advocate for things like fair wages and safer working conditions. So these tactics, these union busting strategies, often involve the use of an outside third party for profit business that the Department of Labor refers to as persuader firms. So these businesses are hired by the hospital to educate and influence managers and teach them how to dissuade workers from voting on or forming a union. So it's very highly coercive behavior that verges and flirts on the borderline of labor law violations. And on average, American businesses spend about $400 million a year on anti union consultant persuader firms. Okay. Recently, in May, down here, the Center for Labor and a Just Economy actually wrote a report to the Department of Labor basically advocating for the regulation of these kind of persuader firms because they really are businesses that are being paid to violate employees' federal labor rights. Why? Why do businesses pay these companies? Why are businesses anti-union? Well, businesses are driven by profit. And on average, the Bureau of Labor Statistics states that union workers on average make about 18% more than their non-union counterparts. If you look here from the Department of Labor, if you look at all the years where union membership was at its peak, wealth inequality from the top 10% was at its lowest. As union membership dips off, wealth inequality on the top 10% rises. Unions help maintain a more equitable wealth balance between the top 10 and the rest of the 90%. Unions protect employees from things like unfair treatment and bad working conditions. And unions give employees a unified collective voice that make it harder for businesses to dictate what goes on in a business without the input of the employees. Reminder that where we live in New Orleans is a healthcare duopoly. You have two options of healthcare here, LCMC and Ochsner. The CEO of Ochsner made $10 million in 2022, and the CEO of LCMC made $2.5 million in 2022. And if you look at the public records, their numbers have continued to go up. Right? So when nurses advocate for better pay, better benefits, better ratios, more nurses, better working conditions, that prevents CEOs from getting million to $500,000 bonuses and raises every year. We're dipping into their profit margins. Without nurses or anyone else that works in a hospital, those CEOs would not be able to make the millions of dollars that they do. There's two flavors of union busting: sticks and carrots. Sticks are punitive punishments to deter employees from wanting to organize. So things like threats, write-ups, scrutiny, harassment, making your job more difficult, surveying you, pulling you in for meetings, things like this are sticks. Then there's also carrots. So carrots refer to like the incentives and bonuses and little treats that you get. Like, you don't need to unionize, here's a little treat. So things like raises, paid maternity leave, more PTO, mental health days, creating things like surveys and open door policies to say, please come talk to us about all your issues. You don't need to unionize because our door's open and we're ready to listen. Fill out the survey and tell us what's going on so we can fix it, so you don't need to unionize, right? These are the tactics that these outside firms that make about $400 million a year are advocating your employers to do. So here are common union busting myths that you're going to see, right? Union dues are expensive. Unions are third-party outsiders. You're going to lose flexibility with a union. Unions are going to force you to strike. Unions are going to discipline you and fine you. Union cards are legally binding and they revoke your rights. Beep, bop, boo. Okay, let's bust them. Let's have a reality check, okay, with cited sources from the government. Okay, so the first one, that dues are expensive. So union contracts, when people make their union, that is something that's negotiated in the contract. We are specifically talking about National Nurses United. So National Nurses United dues are 1 hour of your base pay a month, right? For most people, that's 30 something, some maybe even 40 something dollars, okay, a month. That is nothing when you're talking about the benefits that you're getting, okay? Again, we've talked about, on average, unionized workers make 18% more than their non-union counterparts, okay? You can take my little $37 an hour if we're talking about getting 18% higher wages, right? And that's not even talking about things like improved working conditions, safe staffing, on-call stuff. Like, the benefits far outweigh. Take my $37, please, okay? The second one was unions are third-party outsiders. Okay, unions are made up of us, right? Workers from the company. Union leaders and representatives are your coworkers, okay? And they're elected by you, okay? So that's us. The union is us, the staff nurses. We, the staff nurses, elect another staff nurse to represent us in the union. There is no other human being that comes in and makes decisions for us. There is no other human being that comes and negotiates at the table for us. We do that. We are the union. National Nurses United is the facilitator who lets our union exist and happen, but we are the union. National Nurses United does not make decisions. We do. National Nurses United does not decide what's in the contract. We do. We negotiate. We decide. We are the union. It is not an external organization. It is the collective voice of us, the employees. Okay? Oh, this one. Oh, you'll lose flexibility. Okay? Again, the union contract that is made in the collective bargaining process is made and voted on by us. Whatever we want in that contract, we can put in and vote on, right? So unions ensure clear, transparent policies and protections. So we can still negotiate for things as long as it's in the framework of the union contract. I like self-scheduling. That's not something that I would want to put in the union contract. Maybe somebody else would, but we would vote on it to see how we would like our scheduling. If we like it the way that it is, we can keep it that way in the union contract. Again, we make the contract. We don't vote for a union and then the union hands us a pre-written contract and says, this is what we're doing. Bye. If we like something, we can vote to keep it. It's our choice, okay? Also, things like you're not going to be able to talk to your management. That's bullshit. You absolutely will be able to talk to management whenever you want to talk to management. The only time union reps, who are us, get involved is if management is doing something that is violating a contract or things are getting squirrely, right? The union is there as an extra measure to be like, hey, wait a minute, let's look and see, are we violating the contract? Okay? A union rep is there as backup, not as your manager. Period. The end. Okay, let's talk about striking. So you're going to hear that unions are going to force you to strike. Okay, a strike is a last resort. It is used as a drastic measure. We do not like to do it. The goal is to never strike. The majority of union contracts are negotiated without ever striking. We don't want to strike. It is literally a last resort. A very last resort, and it's voted democratically on if a strike will happen. Okay, so no, you are not going to be required to strike. We vote on striking. Additionally, you may hear that if we strike, or if nurses strike, they're putting patients at risk. So the law states that any hospital or healthcare worker has to give their employer 10 days notice prior to their intent to strike. Strikes are never just you walk out the door and you leave your patients hanging. There's no patient abandonment involved in a strike. Employers are given a 10-day notice. The hospital is given a 10-day notice. And again, we only strike. A strike is only discussed and voted on in dire fucking straits, okay? It is not something taken lightly. It is not a goal. The goal is never to strike. Okay, the next one. Unions are going to discipline and fine you. So, again, union contracts are written and voted on by us, the staff nurses. There are contracts that exist in unions that include disciplinary things or fines, but NNU specifically does not enlist any kind of disciplinary measure or fine. Okay, a union is democratically operated and it focuses on fairness and saneness and safe staffing. It is not a punishment board. It is not to get you in trouble. That's not the goal. Does that exist in the world? Yeah, probably. Have I ever seen a union contract that has discipline in it? No. My husband's in a union. My father-in-law's in a union. My grandfather was in a union. I've never seen a contract that has discipline in it, but I'm not saying that's not in the realm of possibility, but it's not in the realm of possibility in this when we're talking about NNU, right? Okay, and the last one, my favorite, that signing a union card is legally binding, and it like revokes your rights and it sells your soul to the devil or whatever. So signing a union authorization card just is your name and your information that goes to the National Labor Relations Board that says, hey, I would like to hold a union election. The end, that's it. If you want to call that legally binding, sure, you can call that legally binding, but it's not legally binding you to anything. It doesn't force you to join the union. It doesn't lock you into some kind of contract. There is no commitment. All it's doing is going to the board to say, oh, yep, I would like to hold a union election. It is not your vote for the union. It is not saying that you're going to be a member of the union. It's not saying you're paying dues for the union. It's none of those things, okay? It's not legally binding at all. Nothing changes with your autonomy as a human being when you sign a union authorization card. Like, I don't even know. You can read it right here. Right here, you can read this information of what a union card is and is not and what it does. All it is that we need 30% of employees to sign a card in order to even have a union election. That's all that it does. So I don't even know where this idea of like a legally binding thing happened. Like legally binding you to what? Ask your manager. If your manager tells you it's legally binding, ask them what it legally binds you to. Somebody, please. I'm curious what their answer is. Okay, so knowing your rights. So the National Labor Relations Act is a federal law that grants employees the right to form or join unions, okay? It is your federally protected right to unionize, to express support for a union, to discuss organizing with your coworkers, to talk or complain about job-related issues, to discuss wages. All those things are your All those things are your federally protected right. The National Labor Relations Act makes it federally illegal for your employer to prohibit you from talking about a union, prohibit you from soliciting a union during non-union work time, question you about your union activity, threaten you, fire you, demote you, take adverse action against you because of your support for a union, make your job more unpleasant or difficult because of your union support, spy or surveil you, or pretend like they're spying or surveilling on you if you're doing union activity or union organizing, and prohibit you from wearing any kind of union button, badge, lanyard, whatever that you would otherwise be able to wear in a workplace, okay? So I'm going to let you know that your employer is going to violate these laws. They're going to violate all of them. Okay? It's going to happen. So know your rights and stand up for your right. Stand up for your right to exist and unionize and organize. It is your right as an American to collectively bargain and organize for a union. And I think one of the saddest parts about anti-union campaigns like this is that it's never the CEOs that are coming in and getting their hands dirty and violating all their employees' rights. It is middle management that is being sent emails to say, hey, I need you to do X, Y, and Z. And it's like federal labor law violations. So now these middle management nurses are having to come down and terrorize their staff. And all to protect corporate interests. Like, these middle managers aren't even making the big bucks. Like, they may be making $100K. And they're like lapdogs for the CEOs making millions, right? They're doing the dirty work. I know that these middle managers did not sit down in their first day of nursing school and was like, oh my God, I cannot wait to become a middle fucking manager and terrorize my staff and violate their rights. Like, I know that was not their goal when they sat down, and I mean, I hope it was not their goal when they sat down in their first day of nursing classes. Like, fuck, I can't wait to be a guard dog for the corporate overlords, but you know what? Hey, it's gonna happen, and I do feel bad for them. I genuinely do. Sorry to all middle managers who have to do your CEO's dirty work in order to protect millions and millions. I mean, you're not even making so corrupting amounts of money. But I mean, hey, I guess anything to get out of bedside. I mean, if you don't like bedside that much, maybe you are willing to infringe upon your employees' rights to have a union in order to keep a non-bedside job. I don't know what makes these managers be doing this. Sometimes I'm like, maybe they don't know, but they gotta know. Anyway, I can go on a rant. So now you know. And here's all the references.